Hello, Namaste. I welcome you all to the 91st session of Gurubodha. I welcome you all to this session, and we have with us today Dr. M.B. Guraja sir. On behalf of us, all of us students, I cordially welcome Dr. M.B. Guraja sir to this session. Good evening and Namaste sir. This session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. H. Chandrasekhar Udupa. This class is made live for Easy Ayurveda weekly class subscribers. To sign up, please go to easyayurveda.com/video-classes. Dr. Guraja sir runs Dhavla Pentacare Ayurveda Treatment Center in Shumoga. And to consult him or to get his guidance on case-to-case basis, please visit easyayurveda.com/gururaja. He is also, Dr. Guraja sir is also recognized as guru, like official guru by Rashtriya Ayurveda Vidyapit, and he does offer internship through that RAV program as well. Coming to the questions, we are just continuing with the last session's questions. We covered like emergency medicines for respiratory distress, asthma, etc. And coming to a case of hypoglycemia or hyperglycemia. One of the challenges with this is most of the symptoms when a person he comes with the symptoms, hypo and hyperglycemia symptoms often match with each other, and a lot of history also needs to be taken to really decide what exactly to be done at that time. And coming to the symptoms of hypoglycemia, a few of them are hypoglycemia means lowered blood sugar level. It can happen when, for example, a patient of diabetes has overdosed on diabetic medicine, or a patient of diabetes has taken the medicines but he is on fasting. So he can look pale, shakiness, sweating, headache, hunger, or vomiting sensation, irregular or fast heartbeat. So, I mean, all these also matches with many other conditions, like even in a heart attack also person may have these type of symptoms. Next is hyperglycemia, where the blood sugar level is shooting up. This can happen due to, say, increased sugar intake or decreased medicine dosage, and many other causes. So listing out a few symptoms here: increased thirst and dry mouth, needing to visiting washroom frequently, tiredness, blurred vision, unintentional weight loss. This blurred vision happens both in hypo and hyper as well. So one standard practice that is done in the hospital setup is, first we go to soon after we discover, we doubt that there can be sugar imbalance that is causing this, blood sugar level imbalance that is causing these symptoms. Usually first, before doing anything, immediately, like within seconds, the blood sugar test is done. That can be done like in prick test, and there are many sophisticated testing machines are there that are commonly used. And first, the blood test is done to determine whether it's hypo and hyper, and then the treatment is given. If we just go by the symptoms and think that it is hypo or hyper, and just we do the guesswork, we may be harming the patient rather than helping him. Guru sir, how to go about this?
Usually, a patient of hypoglycemia will definitely have that shakiness, sweating, headache, and all those things will be there. But important feature, if it is a very clear hypoglycemia, sweating is the cardinal feature there. Whereas in case of hyperglycemia, that sweating will not be there. That is the one which can easily identify between these two, hypoglycemia and hyperglycemia. So of course, whenever a patient comes, he is alone, he is unable to respond to our queries, there is no attender along with him, then it's the only way is to check out the immediate random blood sugar, and usually that is by prick test, and it gives you a clear idea whether the patient really in hyperglycemia or hypoglycemia. One time it so happened when I was in my internship, I was working as a duty doctor in one of the hospitals, Bangalore. It was a rainy day out, and people have brought one fellow totally unconscious, totally wet in the rain, because he was drenched, because he was fallen unconscious at the road. So the pass-byers, they have taken that fellow to the hospital. So I was attending him in the emergency room, or the what you called as emergency ward. Then they identified our senior doctors were there. They said it is, we don't know what exactly the thing and we don't know the history. The only thing is because those who are accompanying the patient, they're also not known to him. So they can't contribute anything to history. So to rule out whether it is right or not, hypoglycemia or hyperglycemia, you cannot go even for the sweating thing because he was totally drenched in the rain. Whether it is due to sweating or which is due to rain, we don't know. That we can't do it. Identify them or separate them. So based on these parameters, then they said it straight away go for a random blood sugar test. When they tested it, it was very low, below 50, something around 40 or something like that. So then suddenly they infused 50%, 25% of dextrose. Within few minutes, patient got movement and he just sat down and later slowly he recovered from his condition. So that's the way we need to understand and certain important things can be done. Of course, if you find that the thing, if patient is not unconscious, then we can go for directly asking him to consume some sweets or glucose straight away. But patient is unconscious, then we don't have any other option that we need to go for an intravenous after checking through the RBS.
Yes, sir. And if the patient is conscious, then oral glucose or some sugar or just sugar solution that also helps to revive the patient within say a minute. And coming to this hyperglycemia, where this increased thirst and dry mouth and frequent urination, blurred vision, and unintentional weight loss, increased thirst, etc. Like, I mean, if the patient is in the form of a shock, is there something that can be given orally in Ayurveda, or better to, once we know that the random blood sugar level is, say, for example, above 300 or above 400 mg per dl, what can be done on the spot, or better to refer the case?
Usually, we have seen even our OPDs, many times people with hyperglycemia, they'll come. It's more than 400 also, in my clinic only I have seen. But that person doesn't have any of the issues because his issue was not resolving skin condition. There was a tinea infection, it is not resolving at all. And he was losing the weight. Otherwise, he was very much oriented and conscious, and he was responding very neatly to the things. But when I checked, it was the RBS is more than 400. So even I have seen one patient with RBS is above 600 because the machine is able to find out up to 600 mg per deciliter, mg per deciliter. Even it is showing that unable to, very high. It is showing that means it is above 600. Even in that condition, also patient is walking, is talking, is well oriented. So it may depend from person to person regarding the hyperglycemia. Then there will be something like that of that nature. But in those conditions, we don't have anything which can be instantaneously give the result. Looking at the blood sugar levels of that high, it is better to go for insulin injections so that temporarily they can come down. Later we can switch over to whichever the suitable medicines, oral medicines. Then we can have our role there.
Yeah, I mean, when it is like, I mean, till severe, yes, I to have seen RBS being more than 500, 550. They would come normal. I mean, only in very rare cases they go up to the event of coma, when at that time, even if we diagnose it as like hyperglycemia, nothing can be done on the spot because the patient is already in coma, and referral is the best strategy there. And there's a question here that is there any difference for symptoms between men and women? If yes, what are they? According to Yale medicine, there is no big difference between the men and women symptoms, especially with the hyperglycemia and the line of treatment, etc. Even the symptomatology wouldn't change just because of the change in the gender. And so that pretty much solves the hypo and hyperglycemia. And so, and probably we'll take up this diabetes as a separate event. I mean, separate discussion topic. So suppose if say hyperglycemia, and if RBS is say 550 mg per dl, but the patient is like responding well and looks normal, albeit with some diabetes symptoms, obviously. Because it is too high, and there can be some chances of say some cases of emergencies sometime in future before he actually goes and gets his all the tests done, etc. Is it wise to start something with say hyponate or Nishakathakadi, Kashayam, etc. like on the go itself, right from that day itself, so that it doesn't go higher, or we may advise him to, as a client patient, to go and get the other tests done, but he may or may not follow our advice, maybe due to financial reasons, etc. Is it wise to, I mean, if we get RBS as 550, is definitely his FBS is also say very high. We do not know exactly what, but is it okay to at least start with some say Nishakathakari, Kashayam, right from the get-go, just to avoid it going any further higher?
Yes, definitely. Even I have treated such cases. That's what I said when one of the case was around 500 and above range. It was quite normal. He walked into the OPD and he walked everything and everywhere, and he just spoke to me in a very normal way. And his conversation with me was also normal, and everything was normal. But only thing is the RBS was very high. But and it was the first time here it was detected for him. He never knew that he had a diabetes. And in that case, I have started Nishakathakadi Kashaya and even capsule Diapent. I started immediately and asked him to go for the HbA1c later. So this is what it has done, and he neatly responded to this condition in medication. And next 1 month, it was totally under control.
Yes, sir. And I also seen cases like it is like hyperglycemia and RBS is like above 500 and all, and the patient was not diagnosed as diabetic previously. It's quite normal for the person to have a like very high RBS in the first instance, because he was never thought of himself or herself being diabetic. He'll be indulging all the normal dietary habits, like taking sugar, going to festivals, and having sumptuous dinner. All those things will be normal, and because that is normal in the initial RBS or even FBS or PPBS that we do, if that comes higher, we cannot decide that requires insulin. Such a higher type of risk elevation or risk detection is not required, and we can start with say oral hypoglycemic agents and give them time, maybe like in your case, like you gave like 1 month, then it slowly introduce the exercise and the diet, etc., and then take further steps only after say 2 to 3 months of continuous sugar monitoring. Just because the first time RBS gave the result of 550 doesn't mean that we have to be very hyper aggressive.
Definitely. I've even many a times I've seen recently also one of the cases which I posted earlier. It took almost 4 months to respond for his tinea, fungal infection in the groin and the back. He was not knowing that he was a diabetic. When I checked his RBS was above 400. Then along with the treatment for the diabetes, I have given a treatment for the tinea. Then it almost it came to control. The diabetes was controlled in the initial stages. Then his tinea came into control by 4 month end of the treatment. So it was totally clear, and his sugar levels are also normal, and his tinea was totally gone. So like that, if it is a 400, 500, there is no need to worry. Only along with that values, if patient is showing certain emergency situations or symptoms or signs, then it is better to go for an aggressive action, or you can send the patient to higher center for next center for appropriate care. Otherwise, we can handle with our own medicines, because we have got plenty such type of very fast responding medicines compared to like Madhumeha Rakwata and Nishakathakadi Kashaya, and we have even a Diapent capsule, and we have got Nishamalaki tablets, and of course it's a Nishamalaki is comparatively weaker one. We have got a very beautiful Insol N tablet, so they do
Yes,
wonder responses.
yeah, I mean, yeah, we have good amount of this, and often these are used as combination. Like Guru sir gave this example here, the Diapent and Nishakathakadi were used in combination, and yeah, I mean the fact, or when we start the treatment for initial few weeks to few months, the sign to observe is whether the blood sugar level is continuously getting under control gradually, or it is not responding at all. Stable at the top level, and whatever we are giving is not yielding results in about say 2 to 4 months of time, maybe 2 to 4 or 2 to 5. That depends on your experience. So of time, then we can escalate the situation to a higher level. Other than that, we can manage very well the diabetes under this one. Of course, the whole thing differs when the person is totally diagnosed as a insulin dependent diabetic. And there is a question in the comment box here. So are hypo or hyperglycemia or early stage of diabetes? It cannot be said like that, because even a normal person working under a healthy person who is not diabetic working under extreme hot sun, for example in summer, or taking part in marathon also can get hypoglycemia, lower blood sugar level, because he's fasting and he's running, so blood sugar is stock in the body is used up. So that can be a situation. Whereas hyperglycemia is more commonly associated with diabetes. So and there's a question here, sir, that can we suggest Nishakathakadi to all diabetic patients, or is there any protocol to it, sir? Or let me put it in another way. If we are considering, say, Nishakathakadi standalone, till what level of, say, FBS or PPBS or HbA1c can it handle? And beyond that level, we may have to add any other medicine. Is there any playbook, sir? In my playbook, Nishakathakadi, if you want to line up, for example, there's this Nishamalaki Churna, Nishakathakadi Kashaya, and then comes the various combinations here. It can be even sometimes Rasaushadis, or even say Chandraprabhavati and all. Okay, Gura sir has joined back. So yes, sir. So Nishakathakadi standalone, till what level of blood sugar level can be prescribed?
Nishakathakadi Kashaya as well as Madhumeha Rakwata, these two are very beautifully, we can use it even up to 500, 550 ranges also, we can use it. Within the first 15 days only, the things will come down around to 300. And next, with a good control on the diet, definitely by 1 month end, it will come below 200. So this is what I have observed in very drastic and very uncontrolled type of diabetes many a times. But those who could able to control and particularly have a control over their diet, definitely they will have a very good outcome compared to those who are not taking care of their diet. Only they are dependent on medicine. They want medicine to do everything. So such type of people, result may be vary. Otherwise, those who control their diet, definitely with these medicines, the outcome will be better. And many times these people, those who are diagnosed for the first time, are already sometime they are diagnosed and they are taking the medicine, still it is going that way. Then they don't want to turn towards the modern medicine or thing, because they want to take it for a chance to with the Ayush type of medicines or Ayurveda medicines. Once it is somewhat better, then they can feel like that. So there are so many people, they can straight away wishes to take Ayurveda medicines even in that high level of blood sugars. And it is, I never seen that any such high blood sugar, I could not able to control it or reduce it by our medications. I have not come across such cases. Most of the cases, usually they respond normally to our medication.
So in which case, say for example, Nishakathakadi and Diapent, where at what level the necessity to add an extra Diapent comes into picture, sir? At what level?
See, there are two type of things. One is aqueous soluble, readily absorbable material. The other one is a powder format. Many times we know that whatever the liquid we give it in the form of Kashaya and all those things, there will be a lot of inhibition in the pathways for the absorption. Many times even after that, only 30% to 40% could be able to be absorbed by the body. That's why the acharyas have developed the lipid soluble material that can reach further better. So in that understanding, very typically, if a patient weight is around 50 and odd, usually with such high type of sugar levels, I go with 10 ml of Madhumeha Rakwata or Nishakathakadi Kwata thrice a day after food, and Diapent capsule either 111 or if it is required then 202 after food. This I'll go for first 10 days to 15 days, and within that time, definitely if the sugar is under control, then definitely when he comes back with the 10 days of course, definitely his or body weight will be increased. That gives me an idea that sugar has been controlled. If blood sugar levels are controlled from 500 to it reduces to 300, then definitely his body weight will gain, because when there is too much of sugar in the blood, he is to lose those sugar and his body weight is going down. He is losing the body weight. Once the process is reversed, definitely his body weight will gain. That is a clear indication that person is responding, or person's body is responding to the medication and even the management.
There's a question like whether can Nishakathakadi or Nishamalaki be taken as preventive in pre-diabetic condition. As much as I have seen this, Nishamalaki is a combination of simple amla plus turmeric, and this standalone, if someone is pre-diabetic and if he give proper diet and diet and lifestyle advice, make him to move around, exercise, control on the number of calories that is taking per day, sugar, all those things, glucose level and whatnot. I found that Nishamalaki as such is good enough, at least in the pre-diabetic stage. Your opinion on this, sir?
Because Nishamalaki contains only two ingredients, Nisha and Amalaki, which both are we can use it on a daily basis. It doesn't harm you anyway. Even a non-diabetic person can also take Nishamalaki. It has got much other reasons, actions in the body. Nisha is Haridra, a turmeric, and Amalaki is Indian gooseberries, and both are rasayana in nature. So, and the purpose of rasayana also it can be used. So it doesn't mean that it is only given to a diabetic or a pre-diabetic. Even it can be taken by the non-diabetic person also. But being Nishamalaki, it is comparatively a weaker drug when compared to other combinations. So it can be given in the initial stages of diabetes or hyperglycemia and such conditions, or a pre-diabetic stage, what you can call it. But alone Nishamalaki cannot be taken or used to control things. Some other things like Chandrabhavati or something required to maybe combining these things with that, then only it will come to help. And of course, it definitely all depends on where exactly the blood sugar levels of a person is. Depend on that, the dose can be managed. Whereas Nishakathakadi Kashaya, it is better to be used in a diabetic or a pre-diabetic condition where the blood sugars are high but there is no urine sugar. In those conditions, Nishakathakadi Kashaya can be used.
Yeah, Nishamalaki, in which conditions is to be suggested, is already clear. In pre-diabetic, it can be used. And before food versus after food of oral Ayurvedic medicines, do you have any guidelines, sir, where you would go before food or after food?
Particularly this Nishakathakadi Kashaya or Madhumehara Kashaya or any Kashaya per se is technically as said by Acharyas and even to the books. If it is given before food, that will be good. But many a time I have come across when this is being given on an empty stomach, patient later on say that I have lost the interest in the food. I don't want to consume the food. My appetite has come down after taking this. Such type of complaints I used to get in the initial days. So then I changed the plan to use it after food. So now most of my patients, I'll give it these kashayas also after the food. I am getting the results, but no such complaint from the patient that my appetite has been sluggish because of a medication or my appetite has gone down. No such complaints or some negatives from the patients. So that's why I have kept my present prescribing method, particularly for these pre-diabetic and diabetic patients, that I used to give my all medicines of Ayurveda post food. I never give it in a empty stomach, particularly in these cases.
Yeah, thank you, this. And in the last session, we discussed regarding the Dhumapana with Haridra. Can it be taken by pregnant lady or not?
Definitely, it can be taken, but under the guidance of a physician and in a controlled manner. Because if a person doesn't know how much Haridra should be put on the diet, and we don't know the exact allergic nature of that lady who is pregnant, and if something is taken extra as a Dhumapana, then if she develops this continuous sneezing or something like that or cough, then it will be having a continuous jerky motion on the diaphragm, which is exerting on the uterus. That is maybe counterproductive in some cases. So we should be very cautious while handling these type of cases, because if there is a congestion and all those things, there are better other ways to do it. Why you want to go with the Haridra in the form of a fumes? But having said that, if you are able to control the outcomes, or you can have a capacity to remove the fumes away from her or take her away with only that controlled nature, if you are able to do that, then definitely Haridra smoke can be given. That's what last time Dr. Rajnikant Patel was telling, that putting Haridra on the tawa, roti tawa, that's the best method you can do it. Once it is there, you can smell it, and if otherwise, you can go away from that. Or even tawa can be taken off the flames. That's a better thing, we can do it. But better it is always done under the guidance and under the control of a physician. Not, you cannot do it at a home, particularly in this type of case, pregnant lady.
Thank you there, sir. And there is another question which came over with last time. Can Trikatu Dupana be done for swollen tonsils or recurrent tonsil infections? Probably a gargle with, say, turmeric, salt, and lukewarm water is better than depending on Trikatu Dupana when there is already inflammation. Your opinion, sir, please.
Yeah, but it can be taken even along with what I said now, salt and turmeric. Along with that, you can add even to that Trikatu Churna, gargle it. So it will, some irritation will be there, but it helps the local secretions to come out, and it also reduces the swelling. So that can be done.
Can we do nasya karma at night at 11 o'clock?
It depends on the time of the year and the place where you are living. What is the atmospheric condition? Where it is a dry winter or a harsh winter, it's a dry summer or a wet rainy season. All these things will come into play. Can do Pratimarsha Nasya at night, but not other type of Nasyas are not actually going to support us in any way. Only Pratimarsha Nasya can be done.
And Pratimarsha Nasya Kala is that is given multiple times in a day, so I mean that can be done. But if it is rainy, cloudy, and extreme winter, usually
It's better to be avoided.
yeah, because the nasya medicine has to enter deep and give the results what for which we are giving. And with the cloudy, rainy thing with the Shita Guna, it closes the body channels, especially in the head and neck region. So that may cause some obstruction, or it would not give the desired result.
But Nasya with Rechana property can, like one which is having a very katu pungent nature, Nasya can be given in a cold condition also, in order to remove the content from the nose. Or the person after the getting Nasya, this Rechana Nasya, then he may go on continuously sneezing out and remove the lot of watery content and mucus materials from the nose. It may reduce his congestion and even the headache, but that depends on the strength of the person. Rogi Bala should be good, and condition should be supporting. There should be congestion and kapha in the upper Shirobhaga and nasal region, then only you can use it. Straight away, ginger can be taken. Ginger, the few drops of ginger can be taken with Tilataila mixed, and you can take it in. Gives you, I mean, even the Drona Pushpi Rasa can be taken. That does, when Tulsi Rasa can go, they're all very, very irritant and pungent. The patient should be able to tolerate those things. You cannot do it in a Sukumara Purusha, then it will become a very headache. Instead of support, giving relief, it will give you a lot of trouble, and the patient may be worrying, and he may give in turn trouble to you.
Yes, sir. Thank you there. And there's this question on Purana Gritha. Like, if I want to prepare it for next generation, how to store it? Just to give a context on Purana Gritha, there is this concept of Nava and Purana. Nava means new or collected and preserved up to 1 year. This reference is there both in Bhava Prakasha and also in Charangara Samhita. And Purana, say Purana Shali, etc. is told is like old rice. The general meaning of it is, if it is 1 year old, then it is called as Purana. With the respect to ghee, its qualities, etc. gets enhanced, and ghee can be stored for more than a year. 1 year ghee is stored, 10 years stored ghee is stored, even 100 years ghee is also told, which is probably called as Purana Gritha. So, and these are told with like specific benefits. They do not stored for old, they do not have the normal properties of ghee, but they are very much sought after for especially neuropsychiatric conditions. And yeah, they're used in Unmada, Apasmara, all those disorders. So it's very, very well sought after. So as an Ayurveda practitioner, it's a good habit to like store ghee. But the question is like how to store so that it is well preserved with all its qualities. Any tips here, sir?
So one is, you can make an airtight glass vessel, which is amber glass. In that also you can store it. Second thing is any stainless steel vessel with the airtight lid. It can also be done. But if you want to go fully traditionally, then we have got a typical Prut Patra or earthen pot, which is not porous and it is not rough from outside and inside. It will be very neat and shiny, and it's called as Chikana Gada in Hindi. So that type of things are used to store it in a traditional manner, and all these three will retain the qualities of the ghee.
So, do you recommend storing it underground, like how this Aso and Arista are done? At least or just normal storage is good enough?
If it is provision is there, then definitely you can go for it. But thing is, we have seen in many of the places it is kept as it is in the open air, in above the ground. It is not below the ground. The things are maintained. We have got one temple in Gujarat. They have kept the ghee for so many years, because there the people are contributing to God. Some Kameshwara's temple or Rameshwar temple, something is there in Gujarat. There they'll keep ghee continuously for the, and the Deepa will be, there will be Prajwalita every, and it will be 24 hours in a day and 365 days without stoppage. So they will be pouring that ghee and using for that purposes, and they have stored it, and it is just above the ground only with that, what I said, traditional earthen pots, very smooth pots, and they were non-porous. Such type of things are there. Definitely you can use it. We have seen, even we have in nearby my place also, one of the fellow is, by out of his curiosity, he is keeping a mud, somewhat a small vessel, like 300 to 500 grams of Gritha can be stored. Such type of things he has kept for many years, many times. So, and he has just labeled it on the thing that when it is packed, and he is keeping that one. And what is the purpose? He said somebody in future may utilize it. Let me do that. He is doing with that intention.
Yeah, nevertheless, it is a good thing to store for long, and even lighting the lamp with ghee as this one in place of oil is also considered as auspicious, and also probably storing it for long is also a good practice for either practitioners to inculcate. Coming to a few questions which have come here. So, what are the immediate treatment for mouth ulcer? A person with severe mouth ulcers have come. A few things that come into your mind as the remedies, sir, please.
If you are outside your clinic and somewhere outside, and somebody comes and some home, something like that, or some function, if somebody asks you, then if it is a clearly a mukapaka or mouth ulcers or aphthous ulcers, in that condition, the first choice, because we don't have any medication there, then the first choice is honey. If you have got honey, just apply honey lepana repeatedly. That can be done. That's point number one. And if it is in your OPD or your hospital, then we have got plenty of things available in the market, like Shodhita Gairika with Gritha or Madhu. It can be given. And one of the company also produces in that sense with the Shodhita Gairika in the name of Stomatab. And that Stomatab also comes in the form of capsule, as well as it also comes in the form of a gel for local application. Still, if you are outside in a rural setup and something like that, then if you could be able to find out Jati as one of the variety of Jati Patra, Jasminum variety, if you could be able to identify that Jasminum officinarum, botanically, Jasminum officinarum, that one in Kannada it is called as Jaji Mallige, and the leaves of that plant are quite good to the mouth ulcers. And the last option is, if you got any mouth ulcer or ulceration due to radiation and something like that, or a repeated ulcerations, mouth ulcers, then the other choice is Esti Madhu Churna. Not that it is not Jasminum officinarum.
I get all the flowers, but plant.
Yeah, the flowers one, which is very elongated and single layer petal, something like arrow. And leaves of this plant are used, just like take few leaves, chew it in the mouth, keep it in the mouth, and it give you soothing effect, and as well as very early it will heal.
So, and spinach is also chewed. Like raw spinach chewing is also a way of just that mucilaginous thing heals it a little faster.
That mucilaginous thing only gives you just gel-like protection layer. It avoids burning sensation. But for a purpose of healing, Jati Patra is one of the best one, actually, if you get it. Then comes the last one, what I said, for the radiation-related mouth ulcers or the candida, something like that. something that in that related. Then Estimado Churna is the best one. Estimado Churna in the form of Kshirapaka can be used for mouth gargling as well as even for drinking.
Carrie has asked, can we heat water fast and then lower the flame prior to adding herbs, etc.? Carrie, if you have the question in a little bit more detail, it will be helpful. In what context, whether in preparing kashaya or infusion, etc., it will be helpful. And there's another practical question on nasya. We ask to discontinue if nasya burns the nasal passage. What can be the reason for burning sensation? And how do you decide the right medicine in that situation?
Very simple. For what purpose we are doing nasya? The patient is having a nasal congestion and blockage is there and it is due to kapha. We need to remove that one. So that's why we are trying to give such a type of drugs which are ushna tikshna in nature like shunti, drona pushpi, tulasi and such other things in the form of either with honey or with the gritha or with the taila mixing it and we are using it as a drops, nasal drops. And these things definitely they cause irritation. When they cause irritation means we are expecting it and it is irritating only. When the patient is unable to tolerate that irritation, then only we need to go for some soothing effect. Something which we give as a soothing one, definitely it won't remove the kapha and it won't serve our purpose. Here, whenever there is a congestion and blockage, kapha is more in that part, then we need to remove that kapha, then we need to convert kapha into watery nature. For that purpose, it is always katu, tikshna, gunadravya should be used. That's the reason we use ginger, drona pushpi, tulsi or something like that. They're all comparatively local irritant, we know it. But if patient is unable to control that and tolerate that irritation, then we need to go for some soothing things. And in that soothing things, you can go directly with applying a little bit of honey to the nostrils or even to the coconut oil, something like that. It will soothe things.
Okay. How do you decide what dosha is predominant in dasana? So that depends on that is entirely a diagnostic thing. And with kapha increase, it indicates that there's productive cough or sputum production with heaviness and sinusitis. All those things indicate there is kapha increase. And
That
moving
is
on.
very clear. There is a nasal congestion associated with the heaviness in the head. Indicate there is a kapha in the root. Nasal congestion plus heaviness in the head. These two are very important. We can understand with this the kapha is involved. If the patient is having pain in the head along with that burning sensation in the eyes and nose, then it is pitta is involved. But when there is no congestion there, then there is only pitta dominant, then we need to go for something which is coolant in nature used as nasya. In that, the first one is ghee.
And moving on to the next question. Does the use of wheatgrass juice for health have any Ayurvedic background? Just to give a context, when in the 80s and 90s, especially in India, the health consciousness was not that much there. Now everybody wants to exercise, everybody wants to, who those who can afford want to buy organic materials and organic food and other things are coming up, and taking supplements and taking a lot of care for the health has become a trend as of now. It is not so previously. And suddenly in the mid 1990s, when these cricketers started becoming very famous, and fitness also became a fad with the cricketers, etc. There's a big debate when Rahul Dravid, how he meant his energy. He said, I think he said, or he was quoted as saying, I'm not sure about that, but he said that wheatgrass juice is making him, it is helping him with his stamina, especially in the test cricket where he has to perform to a very high extent. He has to bat for many days together. So, is it a superfood, or can wheatgrass juice has any background, or can it be mixed with Ayurvedic diet regimen? Your thoughts on this, please?
I don't know why I'm always away from this wheatgrass juice or something like that because it reminds me somewhere down the line that the Ayurveda never recommended to go for egg. Acharyas mentioned lot of the qualities of mamsa, everything, but they never even they mentioned about the capacity or the balyaness or the of the chicken hen, but they didn't understand. They didn't explain about egg very typically. Similarly, they refused us to take sprouted grains. and even the wheatgrass fall under that category very clearly. Whenever something which is very young is growing by nature, from the genetics or something like that, plant or the animal is trying to prepare some immunoglobulins in that young one, and which will be protecting its life for the future. And if such, when there is a huge amount of immunoglobulin or something like stimulants or some protectors of that mechanism, and we consume them at that stage, sometimes it may be helpful to us, or sometimes it becomes counterproductive, and we may develop a lot of issues. That's the reason you observe that whenever we consume, that is the ginno, we call it in Kannada, the first colostrum milk, that also causes a lot of issues with some people. Even some people will develop allergic bronchitis after that, after consuming that. So very clearly, these things are very much related to one another. So usually, I don't recommend anybody to go for consumption of more and more eggs or wheatgrass or sprouted grains and all those things, because I don't have a supporting background data from the classical text to support the use of this.
Yes, sir. And I mean, with the sprouts, and also like I mean, this siridhanyas. I mean, not exactly falling into this, but now whatever is becomes like a fad diet, it needs to be taken with a lot of care. And there was an article written by an Ayurveda doctor, a famous eye specialist from southern part of India. Unfortunately, we lost. I mean, he's like world famous and has done thousands of surgeries. Even he did eye surgery. I mean, cataract surgery. Remember that. So he died untimely, meaning in his mid 60s he died. I had seen him recently in an airport. He was looking very at that time like very skinny, like unhealthy-ish thin. And somebody wrote this Ayurveda doctor who wrote an article on that, said that that particular big Ayurveda doctor from Karnataka, who unfortunately died, he was into too much into say millet diet and raw fruit and vegetable juices, and there's a gluten-free diet fad, etc. That all these things were introduced into his diet. Probably that Ayurveda doctor who wrote this article was observing this ophthalmologist up and close, I believe, because he has written all these things. Gluten-free diet and avoiding rice and avoiding milk. All these things just to lose weight, and I want to adopt healthy living, and I would even avoid say ghee, buttermilk, all those things, and I would suddenly become health conscious and do this rapid thing. And his theory was that increase of dryness or ruksha quality in him would have made his blood vessels and also the brain, etc., very dry, and ultimately it took his life. I mean, we cannot say that that ophthalmologist died due to this particular reason. But they told even the raw vegetable juices are not so very much recommended in Ayurveda. I mean, they're cooked, and even the green leafy vegetables, shakas, they are explained, and there are a lot of ifs and buts conditions when to use where, etc. So I mean, these fads may come and go, but better to have a shastric reference whenever possible, and then follow that rather than just following what the new fad is throwing something at us.
So usually that's the reason many times for those health conscious and diet conscious people, when they tell about these things, I straight away tell them, see, acharyas have very clearly listed out what is swasthayita ahara, one which should be consumed daily. In that there is a milk and ghee. It is your duty to get the right kind of milk. When it's not available in the market, for that reason you simply cannot just sideline all the ghee and milk in from that. And very clearly, acharyas have said, runam kritva ghritam pibet. If by even making loan also you should go and take the ghee. Why all these things statements are made? Because it has its own effects and benefits on the body. Of course, anything is in excess, definitely it's going to cause the harm. It may be snigdha guna, or it may be ruksha guna, it may be tikshna guna, it may be saumya guna. So whatever it may be guru, lagu, whatever any gunas which is in excess will going to cause the harm. We should always have a balance of all these things. It may be even diet, everything, we need to have a balance, and we need to counter check the things whether I'm doing it right by watching out our height, metabolic activity and body weight and how it is maintaining by week or maybe by month. If everything is going right direction and even we are maintaining all the health and as well as our alertness and everything, then it is fine.
Yeah, I mean, and Moringa suddenly became like famous and other things. There is a famous tweet by one lady here said that are we ignoring our indigenous and native fruits that are a lot cheaper and nutritious? Fruits like falsa, which is called as parushaka, bear, badara, gooseberry, amla and whatnot, mulberry, jamun, mangosteen, carambola, bale, bilofala should be promoted, and they are being forgotten for all the fad and other new exotic things which come in the market, and some pharmacy comes with say makes a juice of it and throws some research at us, and we just follow that, forgetting our native fruits and vegetables. We are already rich.
Definitely, there are local things. So that's why Acharyas have very clearly said when you are living in an area, what and all required for you, most of the things will be around you only. So there is no need to that to go somewhere and pick the things. If it is possible, you could be able to get continental food, you eat it. Otherwise, it is always a suited or better one for you is the food you are genetically predisposed and your forefathers were eating. And the same thing it holds good for you also. So that's the reason. And even for the gluten free and all these things, I don't even identify them. But many times it so happens that people will be worried about these things, those who are even living in India. Wheat was being used in India from thousands and thousands of years. Suddenly, how come the people are getting disease out of that wheat? It is not the gluten or the wheat which is responsible. It is something other than that. We have got something which we don't want to consider, and we are using or blaming something which is we don't know exactly this is the reason for that. Maybe because of their genetic predisposition, or maybe because of the way they eat it and the way they cook it, or something like that. It is causing them some celiac disease or some ulcerative colitis or irritable bowel syndrome or something like that. Then they will go for the gluten-free diet and so many things. Otherwise, if you are eating your healthy food, how your mother or forefathers or your grandmother used to cook, eat it accordingly. If you do it, I don't think so it may going to cause you any trouble. And whatever it is, you do it, you go with a very clear line that dose of the material. Very clearly, we need to eat only when there is hungry, only when there is clear cut. Very clearly, we need to eat Hitabuk, Mitabuk, Kshutabuk, Hitabuk, Mitabuk, Kshutabuk. So Aruk. Only when we need to eat only good things, we eat healthy, eat in quantity, eat in right quantity, then eat only when you are hungry. Then you will be free from all diseases. Arogya will be there.
Probably the right note to end this session with this auspicious. Thank you. I'll see you in the next one. Namaste.